Welcome to the dementia-friendly Prince George's County, Maryland's Northern Sector webinar series for caregivers. Today's topic is insurance-based versus private-pay senior care resources, presented by Lisa Friedman and sponsored by the Prince George's County government and the Department of Family Services. Good evening, everyone, and welcome to the Dementia Friends of America webinar series. We are so glad you are joining us tonight to learn more about dementia awareness and how we can build a more supportive, informed community. My name is Canella, and I am honored to be here on behalf of Dementia Friends of America and our local DFA Northern Prince George's County initiative. Today's session is part of our ongoing effort to increase understanding, reduce stigma, and provide meaningful resources to individuals, caregivers, and professionals impacted by dementia.
Okay, good evening, everyone. I'm Lisa Friedman, and my company is called CareFinder. I'm very excited to present tonight and share a little bit about how I help folk navigate this sometimes overwhelming task of finding next steps for a loved one, and that can mean looking at senior living communities. It could be considering doing in-home care, those kinds of things. So after my story is like a lot of us that have gotten into this industry, I was given the responsibility of overseeing my own mother's care, and as a result of that, it really gave me an inside view of what you don't know, and it's a whole new education. So after her passing in 2016, I decided to take a position in senior services with a home care agency. So I saw the benefits and challenges with having caregivers come inside the home. And as a part of the work I was doing, families would come to me and say, you know, my loved one is really doing, needs more than the level of care they're getting in home, and we need to look for something else. So I was informally helping folk look for and navigating senior living communities as a part of my role back then. And it just sort of grew and morphed, and I decided that this is what I really wanted to do. And so I launched my own business in 2023, and I didn't know how much need there was for someone like myself. So I consider myself a senior guide, and I really enjoy what I do, mainly helping adult children off the ledge and looking at the benefits of being in a role to help a parent or an aging loved one, and how to muddle through all the debris of information that's out there on the internet, and to be able to provide them a deeper dive into the options that are out there for them. So if Caesar wants to move forward with the slides, I'll talk a little bit. So as I mentioned, I get it. I went through this, and nothing gives me more satisfaction than helping someone to navigate this and to do the heavy lifting for you, so you don't have to be tearing your hair out, as the picture says. So when we look at senior living options, and as I mentioned, usually the first foray into providing care for someone really starts at home first. Most people want to see what it can sustain in terms of help for a parent or whomever is needing that assistance at home with some of the activities of daily living that we need at some point in life, whether it's help with personal care, and that can mean just stand assist to make sure someone is steady in getting into a shower or a bath, or helping them get dressed or groomed or toileted, those kinds of tasks, as well as medication reminders. At the level of the folk that come into the home, they are not licensed to actually distribute medications, but they can remind someone that is able to be reminded that they need to take their evening meds or their morning meds. This person can also help with meals, as well as transportation, and mainly, just socialization, companionship, but it's more of a one-on-one type relationship, and it's with someone that is licensed at the level that just covers these types of tasks. If it becomes necessary at some point in time where someone needs more medical support, then that licensed individual really is not able to, because of their licensure, and they don't have the education around providing other support for someone with higher medical or cognitive needs. So that's when folks start to look at, well, what are the options out there for senior living? And that in itself can be, very overwhelming in each category. Many people are familiar with what are called assisted livings, which are communities that can be the large commercial communities out there. You've probably heard of names like Sunrise Assisted Living or Brookdale or Brightview. These are folk that are communities that take individuals when they're looking at needing more than one or two assistants with activities for daily living. But it's not a medical environment in the sense of someone has a lot of high medical or cognitive needs. Now, depending on the community, some of them can take up to what's called a level 3, and others are not really capable in their licensure to do that. So there's that piece. And when you're looking at what is it that you want in a community, it's really important to know, is this just something for the immediate, or are you looking at taking someone through transitioning at higher levels of care? So that kind of in itself helps us be able to minimize the different types of communities that are out there and be able to say what is most important and find those communities that offer either a continuing care type of regime, or ones that maybe just meet the needs of someone that you want to currently with it just being in assisted living. Today, though, a lot of families are looking for more of a continuous stream of care so that their loved one can stay till end of life and not have to move from one community to the next. And that's really the best way to go. And when you look at these types of settings, you have communities that can start at what's called the independent level, where someone really has no needs for activities of daily living, except perhaps needing more community, socialization, perhaps having the access to having meals made and that sort of thing. But they're a pretty healthy person that chooses the independent side. Within a community, you can have independent, and you can have assisted, and you can have memory care, and you can have what's called skilled care at the end. So depending on the actual communities out there, some offer all these different levels of transition, and some just offer assisted and memory care. Some offer just independent, assisted, and memory care, no skilled care. So there's a lot of different variations on the level of care that communities offer. So the good news is, if we're so fortunate to work together, I can help you kind of whittle away and look at what would make best sense for your particular situation, because everyone's looking for something different. And in my world, the most important thing is to see what the current needs are of an individual medically and cognitively first. And then, unfortunately, fortunately, however you want to look at it, senior living is a business. So we have to look at one's budget and to see what the affordability is, because that factors into the options that are available out there. So just kind of giving you an overview of some of the different types of communities that are out there. Let me just reduce, oops, put this down over here. So the first one, as I say, I call them commercial or corporate assisted livings, like Sunrise and Brookdale's and those types of communities. You're looking at the base cost of being somewhere beginning at $5,000 up to $12,000, depending on the care needs. And so when you're considering this, a lot of people think they're given a rate over the internet or given a rate by a salesperson over the phone, and they say, oh, you know, an apartment starts at $5,000, and you think that's very affordable. But once you get there and you have a tour, most communities at the commercial level tack on levels of care depending on the needs of the individual. And those levels of care can go from level 1 to, I've seen, level 8. So you're looking at incremental increases depending on the level of care, and it could go, you know, up another 500 per level, up to 1,000 per level, depending on the community. So it can get quite costly. The other area too to look at is what is the ratio of care to the residents that are there. And typically in the larger ones, it's like 1 to 8, which isn't a terrible ratio. And depending on the level of needs of the individuals that are the 8 in that pool, it can be, you know, reduced down to 1 to 4 if there are 4 that really need a lot more care than, say, 4 that are more on the independent side of assisted services. So it all depends on the level of the needs of the folk that are in that unit. There are times when, depending on the community itself, that the oversight of medical nursing care is not as abundant as it might be in other types of communities. So some now are offering 24-hour nursing care. Others still just have maybe a nurse that's on staff during working hours and maybe someone available at night to call, but not necessarily at the community during the night hours. Now, certainly there are other individuals, from nursing assistants to med techs, that are also providing care during the middle night hours. But as far as nursing care, you know, by licensed RNs, that can vary from community to community. Typically, the size of the apartments in most communities offer different sizes, from studios to 1-bedrooms to deluxe bedrooms to 2-bedroom apartments, and they will all vary in cost depending on the size. So that does impact the base rate of a community. And of course, you receive high quality dining with gourmet meals and happy hours, and many of them have organized outings and events. So that type of community is really for someone that may have a couple needs around activities of daily living, but basically they can thrive and really participate in the offerings of a community. Memory care it's not a new concept, but it definitely has become a level of care that has become very specialized for folk that have cognitive decline and have been diagnosed with dementia and Alzheimer's, because those are the 2 areas that create further complications for someone physically. And so there's times when someone who has declined in either straight dementia or has been diagnosed with Alzheimer's, that they can be unsafe to their own environment, not safe to be around you know, other individuals, because there may be some combative or agitated behavior. There may be a lot of confusion. And with memory care, it's a whole specialized area that specifically works with individuals that need a different, higher level of care in a safe environment. So memory care can be inclusive inside an assisted living community, but on a separate level, a separate floor. And most of the communities offer a setting where residents can still enjoy that level of care, that setting, can move about. In many of them have inside, outside exit ways that they can still be free to walk around. The only area that has a locked way is the entryway into the community itself. So just for the safety of themselves. And with memory care, depending on the community it's in, can also vary in cost, but typically it's higher cost than it would be in just a assisted living level. So that's, and it varies depending again on the size of the apartment. Most times they have rooms that are about the same size, because at some point when someone has higher levels of decline, they need as small of a footprint to live in. So many of those communities offer what are comparable to what they call studio size rooms. So there usually is like a flat rate depending on the room, as well as the level of care. Also has different increments in terms of the cost. So there is this concept that takes folk from independent living all the way through to skilled care, and that's called continuing care retirement communities. And they're known as CCRCs. In our area, they're not as abundant as, and I say our area, I'm speaking really just of Montgomery County, but even in different counties, there's maybe 2, 3 of them that work like this. And I'll try to differentiate this from, say, a smaller type of assisted living. But this is more, what differentiates it, actually, the most distinction between this type of community and, say, just going into an assisted living building that has maybe assisted and memory care, is that this type of continuing care community, you are actually buying in. You are putting in, many people sell their homes and put that investment into being able to purchase the right to come into that community, and most times at the independent level. So for instance, there's a community in our area called Riderwood in Silver Spring, and depending on the size of the apartment, you can purchase one for $250,000 up to over $1 million these days. So it all depends on the size of the apartment. And in addition, you still have a monthly amount for that apartment based on lots of different variables, and mainly meals and activities and things like that, and a monthly amount that goes towards the living in that community. So that's something that some folk love, the concept of being able to buy in and have all their care needs be taken care of through, the continuum of their life, and know that, once they needed more help, they could transition into assisted living, and if needed, into the memory care area, or if they have such high medical skilled needs that would warrant being in the nursing home or nursing care level, they can transition into that as well. So they're typically much larger communities. They're really very similar to a size of a college campus. They have rich, abundant social environment with lots of health and wellness activities and educational programs. And as I mentioned, you can go in. Some communities are 100,000, others are a little higher, and can go well over $1 million today for some of the larger apartments. So that's what they are known as, a buy-in community. So I want to talk about private residential or residential assisted livings in comparison to, say, Sunrise Assisted Living that we talked at before. And just to differentiate what I just mentioned with the continuing care, it's a buy-in with a large sum of an investment. With the standalone assisted livings that may also have memory care level, they're called rentals. And so depending again on the size of the room, the level of care, that's your nut that you would pay every month, but you wouldn't have to buy in with an investment of several thousands of dollars. That's the big difference. There's this other level of care that I find really meets the needs of folk that for various reasons. They may be that they have such high medical or cognitive needs, and that some of the larger communities might be overwhelming for that individual, especially if they've lived alone for their whole life and they're just, the amount of activity is too overwhelming. Or the other side to it is many times these smaller communities can be more cost effective than some of the big guys because they typically will have a fee for the room that's chosen, but and the level of care is determined upon moving into this type of community. And that level of care the pricing will never change. So it's known as an all-inclusive type of assisted living community, which is nice because it helps you plan, and to manage somebody's funds better when you know that if they go in and the cost is $8,000 a month, it's not going to change. And that's the benefit of a smaller type of privately owned community versus some of the corporate ones, that they do increase their prices, and they do increase prices based on levels of care. So this is kind of a unique platform for assisted living. And there's different reasons besides, someone that may not want a huge community because it's overwhelming. There are folk that just like to be able to transition in the level of their needs in a small home-like setting. And I will tell you, some of these communities are absolutely gorgeous, beautiful, renovated homes where, residents just feel they're living the life and getting the best care. Many of these communities have been started and are owned by medical professionals like RNs and MDs. And why I really aspire to them is that it's important to me as a senior solution specialist when placing people that they are seen through the lens of a medical professional on a regularity, a regular schedule. And I really like that. I feel like it contributes to getting people healthier because it can offset or mitigate other conditions that can accelerate in some larger communities that might not be caught right away. Like, for instance, UTIs are very, they're very toxic to the elderly. And if you don't catch them in time, it could really mean the difference of, living or dying, really. And so I find in these smaller footprints of assisted living that when someone's being seen with regularity through a nurse or a doctor, they see these changes happen very, up close and personal, and can, address what's happening, get medication immediately. And so to offset having to go to a hospital setting. And I really am very much a fan of these, and they work very similar to the bigger assisted living communities in that they partner with all kinds of medical partnerships that come in, from geriatric psychiatrists to nurse practitioners to podiatrists. They even have mobile dentists and mobile phlebotomists that can draw blood work and x-rays. So they make it very simple to do all the services within that home to make it easier, so the individual doesn't necessarily have to go out to get those types of medical services. Now, certainly if they have a specialist, they would certainly go out and see that person as well. And depending again on the community and the size of a room and what their specific offerings are, some of the communities can range from minimum 5,000 up to over 12,000 a month. So they're in the same kind of range, in so to speak, to the larger communities, assisted living communities, but the difference is your pricing won't go up. It will be all inclusive. And so that's a big benefit. But it really, you know, it's up to what you think your loved one would want in terms of an actual setting. If there's someone that still has a lot of, you know, energy and loves all different types of activities, then a larger community may be a better fit. If you have someone that's more, you know, a quiet person that is better with a small handful of folk to live with, then maybe a smaller community would be more preferential. And these typically, the size of these small homes are they usually can hold between 5 and 8 residents. So it's more of an intimate type of environment. So nursing homes, some of you may have had some experience if you've ever had a surgery or an elective surgery, or, you know, had an incident where you've broken, you know, an arm or a hip, or, you know, have had something that's been an insult to your body that warrants going into a short-term rehab setting to get stronger. You were very much in a nursing home, because nursing homes have two sides. They have a short-term rehab, and they also have a long-term nursing side. And the difference between those types of levels of care, whether it's short-term or long-term inside a nursing home, those are paid by insurance. So those are insurance-based care. They're not meant to be like an assisted living in the sense of all the other attributes that are offered with assisted living communities, from the level of activities and immersion of medical practices that come through, where they're really working on trying to get you as independent as possible. If you've had, you know, some kind of a fall in the past, their emphasis is to provide safety and to keep you well in terms of your activities for daily living around personal care and meals. But it's not going to give you the type of setting that you would get in an assisted living. So it's okay for a short time to get better from some kind of a medical incident, but even with that, I always encourage my clients that are moving to assisted living from a rehab to make that rehab stay as short as possible, because other things happen when you're in bed all day. And most times when people go into a short-term rehab, they get lots of physical therapy, but maybe 40 minutes a day, 5 days a week, but the other, you know, 23 hours or so, they're in bed. So that comes with its challenges too. You end up, you know, with bed sores and things like that. So it's always best if you make a decision from that position of being in a short-term rehab, and you know you want to go on to assisted living, it's best to make that move sooner than later. You still can map over the physical therapy, occupational therapy, speech therapy, all of that can be transitioned over into a community, because all of that's still covered by insurance. So this is the other issue with long-term nursing homes, is the ratio of care to the residents or patients is like 1 to 15. So that's where it really differs. It's not an assisted living. It's basically just being managed, and with the minimum amount of support, if that makes sense. And if someone is converting to long-term, they have to spend down any kind of assets before they can qualify for Medicaid, which would keep them there till end of life. And many of these communities, or excuse me, nursing homes have a wait list. So it's not as easy as one thinks, but certainly it's out here as an option. If someone doesn't have a lot of resources and needs the care, then, you know, we do have this type of setting. And what I just spoke about was rehabilitation. So again, it's best to use the short-term rehab for what services you're getting in physical and occupational therapy. But the sooner you can make a decision to go on to a more supportive environment that can give that, it's a much better potential of getting even more care around whatever the medical condition that brought you to the rehab. So again, these are the things that I, as a person, you know, come to the table with. I look at someone's budget. I look at what are some of the possible benefits that they could also access financial support from. There are all kinds of veterans benefits that can actually provide money for contributed towards the payment of assisted living. There are long-term care insurance policies that people will use to pay for some or all of their care. Excuse me. And so that's a really big consideration. And I really try to help my clients be as fiscally conscientious, because I'm not just in this to place people, I'm in to track them, to make sure that their resources last them. And to be quite honest, I try to keep people from having to do end of life in a nursing home. And I can say to date, I haven't had one individual that's had to leave the communities that I've placed them in, because the folk that I work with keep people to end of life, which is a wonderful thing. Sometimes religious preferences is a factor in deciding what is most important in looking at a community, what type of social interests. A lot of people are into pickleball these days, so, you know, look at communities that offer different things like that. And then, excuse me, what their health needs are, because that's really essential, first and foremost, when we look at what are the options out there. So as I mentioned, you know, a lot of people want to go the route of trying to age in place. And if you have the resources, there are many that stay in their homes and get them retrofitted to accommodate a walker or wheelchair, put in stair lifts, you know, different things that make it safe. And, you know, they factor in the cost for caregiver services. It can be much more substantial than choosing an assisted living community. So that's different. But if that's your choice in getting the care that you want in home, then, you know, that works for you. The only drawback is the difference is that you get more medical oversight in an assisted living. If you get care in home, it's predominantly from what are considered certified nursing assistants that really aren't medical. They're there just to help with activities for daily living. So the key services I offer, I don't charge for consultations, you know, for giving out my expertise around how I help people look at and be able to compare options that are out there. How I make a living is if we happen to find along this journey of discovery that there is a good community and you decide you want to place your loved one, I have partnerships with all types of assisted living communities where if I place someone, I receive a referral fee. So it's nice for my families. You're not the ones that have to pay me for my services, and I like working like that. I am a part of the tours, so I can help provide you with a deeper dive into communities. There's one thing to, try to vet a community on the internet. You see all the, shiny things that are within the community, but to really understand where they are in real time, because things change in terms of the operations of a community, the administration, the activities, the costs. There's so many variables that change depending on the ownership. Sometimes these communities are bought out by other companies. So that's where I keep on the dial for my clients and say, this company is going through a transition, this community, we may want to wait on that for now. So that's where my expertise comes in to help you see what's really current in a community that might be a 5-star rated, but right now they're more, they're going through a lot of transition and we don't know how things are going to shake out. I have all kinds of resources to help with the transitioning if someone does choose to leave their home and go into assisted living community. So I'm kind of the senior Google here. I have lots of professionals that do home downsizing, move preparation assistance, lots of community resources. If someone needs help around their financial part and medical and needs kind of a advocate, there are what are called care management referrals. They're wonderful social workers that have that training in the area of senior care, and I work with many of those folks, so that is also an area that could be helpful to in your process. And I go out and I do different types of programming like I'm doing tonight to be able to further educate the communities. I bring in all kinds of other types of healthcare groups, such as physical therapists and occupational therapists and different types of rehabilitation program directors, and just really try to immerse my communities with lots of education around understanding the differences of what care looks like and the costs and what is covered by insurance and what is not. But typically across the board, any community, whether it's a CCRC, the big continuing care communities, or the smaller assisted livings with memory care, or these residential based assisted livings, any medical services that come through are covered by insurance. So what you're typically paying for is your stay, your apartment, and the level of care that you need. And the difference between the continuing care communities and the ones that they can provide what's considered continuing care, but they're different in the sense of the costs. So they're more rental based, and the ones that are known as the CCRCs, the university type size communities, always are known as buy-in communities. And these are just some of my reviews by clients, and certainly can go on to my website. I think at the end I have my link to my website. You can move that forward, Caesar. Yep. So if you're going through this or you're thinking about it, it doesn't hurt to speak to someone like myself. As I say, I don't charge, so many times I'm just a good sounding board for folk. Feel free to reach out to me. I'm very passionate for the work I do, and if it just means, giving you information at this point in time, that's fine as well. So I just want to thank you so much for joining us tonight, and I look forward to any questions. I don't know if the folk are still on or not, but feel free to reach out to me afterwards too.